What if I told you that a significant portion of the adult population in Australia is walking around with a hidden structural change in their colon? A series of tiny balloon-like pouches, and they won't have a single clue until the moment one of them turns into a potential medical emergency. In my clinic, diverticular disease is one of the most common conditions I see and diagnose, yet it's also the most misunderstood. People think it's a death sentence for their diet, or that they have to stop eating seeds and nuts forever. Today, let's pull back the curtain on this condition. We're going to look at why these pouches form, the subtle warning signs that you're moving from diverticulosis to diverticulitis, and the strategies we use to keep your gut safe and inflammation-free. To understand diverticular disease, you have to imagine your colon as a hose. Over time, if the pressure inside that hose is persistently too high, usually because it's working too hard to push through small, hard stools, the inner lining starts to bulge out through weak spots in the muscle wall. These bulges are called diverticular. If you have these pouches but they aren't causing trouble, you have diverticulosis or diverticular disease. In Australia, about half of people over the age of 60 have this, and most will never know. The suspense begins when one of those pouches becomes blocked or torn, leading to an infection, diverticulitis. The signs that you've crossed the line from having pouches to having a problem are often sudden. It usually starts with a sharp, persistent pain, typically on the lower left side of your abdomen, though in some cases it can be on the right. This isn't just a cramp, it's a pain that stays and often brings a fever, nausea, and a noticeable change in your bowel habits. If you feel that left-sided sting combined with a fever, that's your body's emergency siren, and we need to take this very seriously because an untreated flare can lead to complications like abscesses or even a perforation, a hole in the bowel, which is a surgical emergency. But let's debunk the biggest myth about diverticulosis right now, the seed fear. For decades, doctors told patients with diverticular to avoid nuts, seeds, corn, and popcorn, fearing they would get stuck in the pouches. In 2026, we know this is completely false. In fact, large-scale studies have shown that people who eat more nuts and seeds actually have fewer complications. By avoiding these high-fibre foods, patients were accidentally making their constipation worse and increasing the pressure in their colon. The no-seed rule is officially dead. Variety and fibre are your best friends. So, how do we treat it? If you have an acute flare-up of diverticulitis, the approach in 2026 has become much more refined. We no longer automatically throw heavy antibiotics at every mild case. For many uncomplicated mild flares, we use a gut rest strategy, a temporary liquid diet for a few days combined with close monitoring. This allows the inflammation to settle naturally without disrupting your gut microbiome with unnecessary drugs. However, if the infection is moderate or severe, we use targeted antibiotics and in some cases, hospitalization for intravenous fluids and/or antibiotics. The real magic, however, is in the prevention. Once you've had a flare, your risk of another one is about 20 to 30%. To stop the pressure from building up again, we focus on the high-fibre pivot. In Australia, we're historically a low-fibre nation, but to manage diverticular disease, you need to be hitting 25 to 30 grams of fibre a day. We also look at the role of mesalazine, or specific probiotics that help reduce chronic low-grade inflammation in the colon wall. One thing I must warn you about. If you've been diagnosed with diverticulitis, the 2026 guidelines insist on a follow-up colonoscopy about 6 to 8 weeks after your symptoms have cleared. Why? Because the inflammation of diverticulitis can sometimes look very similar to a hidden polyp or even a tumour on a CT scan. We have to go back in when the smoke has cleared to make sure the fire didn't hide anything more serious. Diverticular disease can be a wake-up call from your digestive system, but it's one you can manage successfully. It's about lowering the pressure, embracing the fibre, and knowing exactly when to seek help.